Okay, we're going to start with the vital signs. So I took the blood pressure, and it was around 60/35, which was between normal limits. And now I'm going to take the pulse and the brachial artery, and I'm going to count for a full minute. We'll do this one. Okay, it was about 120, which is also within normal limits. And now I'm going to check the respirations for another minute. I'm going to look from the side. Okay, and the respirations were about 45, which were between normal limits as well. And now I'm going to check with crying. It was a strong and lusty. It had a moderate tone and a moderate pitch. It usually lasts between 3 and 7 minutes once a stimulus is applied. The temperature was between 97.5 and 99 degrees Fahrenheit. The weight on this scale right here is 5 pounds and 8 ounces, and the length is in normal limits between 18 and 22 inches. The posture is also flexed and hands are tightly clenched. The neck appears short and it is resting on the chest. Next, I'm going to check the skin of the newborn. The color is consistent with ethnic background. It is a pink tinged and it does not have blue feet or hands, which is also known as acrocyanosis, but that is not abnormal to have that, but this baby just doesn't have that. The texture is smooth and soft and flexible, and there's no dry peeling hands or feet. The turgor I'm going to check on the side, and it is elastic and returns within normal limits after pinching it. The pigment is clear and milia is across the bridge of the nose and the forehead. And I'm going to check and I'm going to blanch between the eyes above the nose to check how fast the blood returns to the surface, and it returns almost immediately. Next, I'm going to check the circumference of the head, which I'm going to measure across the frontal lobe and the occiput, or the occiput, whatever. And that is also within normal limits. It's between 12.5 and 14.5. Next, I'm going to check the fontanelles. And the anterior one I'm going to feel across the skull because the sutures have not gone together yet. So the anterior fontanelle is diamond shaped, and the posterior fontanelle felt back here is triangular shaped. And there's a slight pulsation, and there's moderate bulging when there's crying or their baby is passing stool. The hair is smooth and fine, and the scalp has some hair over the eyebrows. The face has symmetric movements, and all of the facial features are symmetric between the two eyes and the nose and the mouth, and the eyebrows and eyelashes are also symmetric. The ears and eyes are at the same position, so you can draw a line from the corner of the eyes to the top of the ears to see if the ears are in proper positioning. The cheeks are full, and the nostrils are of equal size. They lie equally midline in the middle of the face. Okay. Next, the face shows grimacing, and it's symmetric when resting and when crying. The eyes are bright and clear, and they are even placement. They move in all directions, and they are a bluish-gray slate color. The eyelid positions are above the pupils but within iris no drooping, and the eyelids are on a parallel plate. The blink reflex is in response to the light, and eyes open wide when the light is not present. There's no lumps or redness, and the cornea is clear and the sclera is white. The corneal reflex is also present, and the pupils are equal in size, and they're round, and they react to light by accommodation. The vision is 20/200. It tracks the movement object in the midline. It definitely prefers faces and geometric designs and black and white to colors. There's presence of lashes, and when the baby cries, it is commonly tearless. The nose is flattened, and that could be a result of the birthing process. It's small and narrow, and it is midline, and it is in an even placement in relation to the eyes and the mouth. The patient's nares are bilaterally, and they respond to odors. You can check the patency of the nose by letting the baby suck on your finger and closing one nostril and see if they continue breathing, and you know if they are having trouble breathing, if they stop sucking or make some kind of motion. The function of the facial hypoglossal, the glossopharyngeal, and the vagus nerves are symmetric of movement and strength. The presence of the gag reflex and swallowing coordination with sucking reflexes, they are adequate, and so is the saliva. Now I'm going to palpate the hard and the soft palates with my finger. The uvula is also midline and symmetric. The palates are intact, and they suck well when stimulated. The esophagus is patent, and some drooling has occurred. The tongue is midline, it is free with movement, and it is pink and smooth. It is proportionate to the mouth. It is neither too small or too large. The external ear has without lesions or cysts or nodules. The hearing has cleared with the eustachian tubes with the first cry. And there has been absence of all risk factors on the ears and hearing. The baby reacts to sounds or sudden or loud noises, which elicits the Moro reflex. The neck is short and straight, and it is creased with skin folds. The posterior neck lacks loose extra folds of skin, and the clavicles are straight and intact. The Moro reflex is elicitable, and it is symmetric with the shoulders. The chest circumference is measured across the midline of the nipples, and it is about 32.5 centimeters. It is wider than it is long. The normal shape is without depression or prominent sternum. The sternum is about 8 centimeters long, and it has bilateral expansion. There's no intercostal, subcostal, or clavicular retractions. And I'm going to listen to the breath sounds. It is important to go from side to side so you're able to compare the lung sounds. The chest and axilla are clear when crying, and the bronchial sounds are bilateral and the air entry is clear. The breasts are flat with symmetric nipples, and breast tissue diameter is about 5 centimeters long. And there's about 8 centimeters between the two nipples. The heart, I'm going to auscultate next. There's a regular rhythm and rate, and there are functional murmurs and no thrills. There's a horizontal groove at the diaphragm, shows firing of the ribcage to mild degree. The abdomen is a cylinder shaped, and it has some protrusion, and it appears large in relation to the pelvis. Abdomen, there's no cyanosis, few vessels are seen, the umbilicus has no protrusion, and it is a bluish white color. The cutis navel is a granulation tissue present in the navel. There's 2 arteries and 1 vein apparent, and there's no bleeding. Now I'm going to also take the bowel sounds. I gotta make sure I listen in all 4 quadrants for 10 to 30 seconds. I'm going to check the different pulses. So the femoral pulse is palpable and equal bilaterally. In the inguinal area, there's no bulges along the area, and there's no lymph nodes felt. The bladder is percussed 1 to 4 centimeters above the symphymosis. Start on the percussion. And the urine has a mild odor, which the child should have urinated either 3 hours after birth, if not at the time of birth. Now on to the genitals. If it's a male, the penis is slender in appearance, and it's about 2.5 centimeters long by 1 centimeter wide. The normal urinary orifice, urethra meatus, is at the tip of the penis, centered, and the non-inflamed urethral opening. Foreskin adheres to glands unless it is uncircumcised for 2 to 3 months. Erectile tissue is present. The scrotum has skin that is loose and hanging or tight and small. Extensive rugae, and it is a normal size. The normal skin color. The scrotal discoloration is common when a baby is breech. The testes are descended by birth, and the testes are about 1.5 to 2 centimeters long and large. And a female newborn, it's a normal skin color. Sometimes the pigment is darker. The labia majora covers the labia minora, and it's symmetric in size, which is appropriate for the gestational age. The clitoris is usually rather large because it has edema and bruising, and the vagina, the urinary meatus, and vaginal orifice is visible. Discharge may be present under the labia, and that has to do with the mother's hormones when the baby was born. Now I'm going to flip the baby over. I'm going to look at the buttocks and the anus. It is symmetric along with the skin folds and the thighs. The anus is patent. And there's been a passage of meconium within 24 to 48 hours after the birth. And there's no fissures, tears, or skin takes. The extremities and the trunk are short and flexed. Extremities move symmetrically. There's a range of motion, and they have full extension. The arms are equal in length, and they move bilaterally, and they're flexed when they're quiet. The hands have the normal number of fingers, just 10, and normal palmar creases, and the normal sized hands. The nails are also present, and they extend beyond the fingertips in a full-term newborn. The spine is C-shaped. It is flat and straight when prone, and there's slight lumbar lordosis. It's easily flexed and intact when palpated. At least half of the back does not have lanugo, and the back is straight. The hips have no sign of instability. The hips adduct to move more than 60 degrees. They are symmetric in the inguinal and buttocks creases, and the legs are equal in length. The legs are shorter than the arms, and the foot is in a straight line. Foot pads and creases are on the soles of the feet and the talpes planus. The motor functions are symmetric with movement, and there is equal strength in all the extremities. They are somewhat jerky, and there is brief twitching. The head leg's not over 45 degrees, and the neck control is adequate to maintain the head briefly. And that completes the assessment of the newborn.